And welcome everybody to the COVES Community of Practice webinar. It is JulAugust, as promised, spanning our late summer months. And today we're really focused on the continued recovery effort at all of our sites. We know that operations have shifted a lot. I know that several of our member museums, New York Hall of Science, Exploratorium, I think COSI, all have opened since our last webinar, which is really exciting for everybody because they were closed a long time. I'm sure they're the most excited out of all of us. So I'll get started with just some, I'll call it housekeeping, but really it's what was promised on our last webinar. And as indicated in the invitation, we used all the input from your perspectives about the existing COVES instrument, the survey, specifically the survey questions that were amended in response to the pandemic. And we do have some notable changes that will be coming up that I want to make sure everyone's aware of. First, we're going to be reverting the income question back to its pre-pandemic function. So rather than asking people, before the pandemic, what was your household income and has your income been affected by this? Yes, it's gone up. No, it's, whatever. That's going to go away. It's really hard to have a memory of what life was like 14, 15, 16 months ago. So we're just going to ask, what is your annual household income? Secondly, in an effort to not mislead any of our visitors about the science behind COVID transmission, we're going to remove from the core set of questions, how comfortable were you touching the available exhibits today? We all know that, it's spread primarily by airborne transmission. Cleaning is always important, but that question is kind of scary to folks, more so than it needs to be. Now, I say it's going to be removed from the core questions because we will leave it available as a site-specific addition if you need to keep it for any reason. I mentioned some of those sites that recently reopened. You specifically may want to keep it just for the earliest months of opening to see how things are faring. But that will be removed from the core set of questions, which is great news because the instrument, your survey is going to be shorter. For now, we are keeping the set of questions that asks about the level of comfort with health and safety and the museum's response to that, concern with health and safety and the museum's response, because we're interested in those open-ended follow-ups. All of you mentioned that the feedback we get through those qualitative responses was really useful. So those are going to stick around for now. We will continue monitoring things as the situation changes, which is largely the focus of today's call. So with that, the questions and measures team is also meeting this week, and we will continue to make additional changes. So there may be additional ones coming up, but those were some of the ones specific to the pandemic response that we wanted to mention to you. But there's some other good stuff that could be changing as well, and we'll of course share that with this community as soon as we can. All right, that was a lot of talking. So now I'm going to open it up to where we really wanted to start today, which is just how are things going at your sites? I'll do even though I said I did a lot of talking, a long-winded intro. I feel like a month ago, we were all talking about shifting our data collection practices, possibly away from the email method back to on-site sampling. I know at the Museum of Science in Boston, we have done that. And in that month, we've seen the situation around us kind of slide back down. I know it's different in all areas of the country, but I'm really curious to hear what things are like. And so we've got a set of questions, and I'd really love to hear from all of you. So first of all, for those of you doing in-person data collection, how's it going? And has anything changed in the last 6 weeks since we last spoke?
Hi, everybody. I'll go ahead and start because we have started our in-person again since the last meeting that we had. And we have been doing better than I expected, I'll be honest. We have gotten about 40 respondents, which has been pretty great. Our numbers are ramping up, which is helping as well. Our attendance numbers are going up. But one question I kind of had as well is I just actually had one of my survey people ask me today, if somebody declines because they want to do the QR code, which we now have posted, that's still a no, correct? Right? When you put it in, that's still a no as a decline on the survey.
Really good question. I'm curious to hear how others are treating it. But from my perspective, when we've been tracking our own in-person data collection, if someone scans the QR and I see them activate the survey, I don't count it as a no, but I don't count it as a yes. So in other words, I don't count it as a completed survey. It falls out of the equation of the response rate, if you will, because I want to believe they're going to do it, but we know that the response rate for the QR, or the completion rate for the QR participants, is slightly lower than if you actually see them complete the survey in front of you. So we've been noting, I approached 9, I got 5 people to say yes, 3 people said no, and then in my note section, I put 1 QR, something like that. Because I don't want to artificially inflate my completed survey response if I don't know that they did it. But it's not a no, right? They didn't say no. They said, oh, I'm really busy. Can I do it digitally? Or like, oh, I don't want to touch your iPad. Can I do it on mine? So that's how I would treat it.
No, that's very helpful. Thank you. I told them originally, I said, just do it as a no, because also like, I can't trust that they're going to fill it out.
Exactly.
And so that was my initial response, but I think yours is more comprehensive. So I'll be happy to pass that along. But other than that, no, it's been, like I said, it was actually more successful than I thought it would be in person, getting responses. So people are willing to share their thoughts. And I think they're very willing to share thoughts when you ask them to about COVID procedures.
Hello. I raised my hand, but I don't know what the protocol is. I'm new to the group, kind of. I'm also Rebecca Null at the St. Louis Science Center, different Rebecca Null. And we've been doing in-person data collection. I'm new to the St. Louis Science Center as well. I've only been here about a month, but I've done I've done COVES previously at COSI. And we've noticed our numbers have been pretty consistent. But St. Louis City came down with another mask mandate recently. We've had a little bit of resistance just in terms of like the vibe people have in the Science Center, and we've also reduced capacity again. So we've seen a little bit more kind of grumpy attitudes, but generally speaking, we haven't really noticed any changes. And then as far as like noting any QR codes, we actually on our like sheet that we have like the tally marks, we have a section for QR code where they stayed and then QR where they walked out. Just for our own kind of note taking, basically, to like see, are people wanting to scan it, and if they do, are they still staying in the building, or are they actually just walking out with it, and we may never see any data from them. So I don't know if that's helpful, but we have kind of it just blocked out.
I think that's really helpful, and that responds directly to Beth's question about if you see them do it because they're working on their own device on site through the QR. So I agree, the tracking is great if you can do it that way. And Beth, if you see them complete it, I would see counting it as submitted, totally fine.
Hi, so I'll just go since I'm the other Rebecca Null. I'm at the Mayborn Museum. At Baylor in Waco, Texas. We have not started in-person data gathering yet for a variety of reasons, but I was just looking at our dashboard from email and QR codes. And so since the Delta variant is exploding, particularly in Texas as a hotspot, we are getting a couple more people kind of asking for a mask policy, which the university currently does not have. So we'll just kind of see how that goes. We don't know at this point if the university is going to take a step back or continue moving forward. I think everyone was hoping to have a normal fall experience for the college students, but we're just not sure how that is going to happen.
That sounds like a similar story from at least a couple other member sites that I've heard from, who have been saying, I'm going to switch to on site, right? In-person sampling. And then it's just been hard to initiate. And then right now it feels particularly hard. But I don't know that Leanne is here. So I'll speak on behalf of the Museum of Science, and doing data collection the last few weekends. I can say that the visitors that I spoke with definitely were receptive. They I had a handful of QR codes, which was great. I'm happy that we're able to accommodate them that way, but I didn't sense any reluctance to participate, reluctance to speak with me, reluctance to touch our iPads, whether I handed it to them or used the stand. We were using both as a trade-off. So for those of you who have been able to get started in person, I think that with the proper precautions in place, it can be done. But I know that making that switch, if you've been emailing, is difficult for lots of reasons.
Yeah, we're also just a little short on staff as well, as I'm sure a lot of institutions are. So we're just going to have to make sure we fold it into our regular operation. But we are mostly, our floor staff or front of line staff are student employees. Since we're part of the university, there have been not as many student employees that were willing to work over the summer. I see Holly nodding. I think a lot of them kind of just wanted to get out of the restrictive university environment that they were living under for the last year. And then we've just had some other shifts in our staffing this summer. So we're hoping maybe in the fall we'll get back going.
Yeah, I would echo we're short staffed. I mean, a little bit student wise, but our visitor service team, especially our ringer for in-person data collection, has taken a new job in Milwaukee. And so one of the questions I have related, so we're still using the email survey. Is it possible to do, but that's only for people who pre-purchase tickets that are that we're capturing that information from on the email. And so I was curious if and maybe I missed it, if there's an option to have like a QR code or ask people for that. Like, can I do both, or is that a bad idea from a statistical methods perspective? Since we have probably half of our tickets are walk-ups.
That's a really good question, and you didn't miss it. We've discussed it at different points over the different calls. So the nice thing, as most of you, if not all of you know, the tracking method is now embedded in the URL, right? So that link that is specific for staffed data collection, or for example, if you use the test link to go through your survey, that's embedded right in there. So the QR code has method equals QR in there, so we can distinguish those responses, helping us track, which helps you track. The one caveat I would place around that is that if you're allowing the QR on the same day that you're emailing out responses, you won't know if the person you've provided the QR to is then going to go home and receive their email method as well. And we don't want to double survey, right? You don't want to fill that pool. So basically the advice we've been giving everyone is, if you have the wherewithal to do both methods, that's fine, but make sure you don't do them on the same day. And so from my perspective, the email is almost like it's a day later. So if you're doing the QR one day, you shouldn't then send the email out for all the email addresses you have the next day. You need to space it out appropriately.
Yeah. And right now our emails are going out like once a week after, like it's a batch. And so that should be fine. The other thing I'll just say is that today is the first day that the University of Minnesota has reinstated its mask policy inside all university buildings. And so, which is a change for us and our visitors. And I'm the floor lead today, so I was at the front doors. Knock on wood, it's our first day. People read the signs, they weren't grumpy, and if they didn't have a mask, they were sheepish, and I handed them one and made their day. So I'm hoping that's a good thing. I think we were a little bit lucky that it's been like a front page news story here in the Twin Cities, and so I think that there's a heightened awareness there for that. But and then back to what kind of in Rebecca's shoes, like I don't anticipate us going to in-person surveys and in the near future. The email piece is working well for us, and we're hearing from our visitors a deep concern about not everybody wearing masks, and so it'll be interesting to watch what happens now that we are able to enforce mask wearing.
I'll go next. Betsy Matt Turner from the Putnam Museum in Davenport, also looking like a duck today. I guess first, we just had our leadership team meeting
Patrick,
and decided
in the middle of a Zoom call.
Go ahead, Betsy.
Okay, and our mask mandate for everybody is going back in effect tomorrow. We'd gone about a month ago to recommending it for everybody and requiring it for kids who weren't yet eligible for the vaccine and staff. But tomorrow we will be going back to full mask mandate. A number of organizations are doing that around here as well. We have in the past had some pushback from people who didn't want to wear masks, very upset about it. But I think we're also seeing more of that move toward more people wanting to wear masks again. So I'm hoping it won't, we won't have any more or worse issues than we do now. We did just decide to take a live event we typically have regarding monarch butterflies at the end of this month into a virtual event where we'll have kits that people will pick up ahead of time. So we are kind of seeing some issues arise again, and after school program from our largest school district just decided across the board they're not doing any outreach from outside organizations. They're not doing any field trips, even field trips that are to outside places. We started with COVES in February, and we started with in-person surveying, and we've done it since then. I think the first month or two we met our goals. We've had some staffing issues as well, particularly as we've had attendance rise, but then there was a lag in getting more frontline staff in place. We've just hired a few more. We were, I think, closer this month than we were last month to reaching our goals, but hoping that those new folks will help in that regard. So.
Great, thanks. And I just want to acknowledge what's going on in the chat as well. If you're not reading the chat, please do. And speaking of which, we've got several new art museums who have been starting to collect data and are commenting how good they're doing. And I'll highlight two, the Asheville site and the Seattle Art Museum have been doing in-person data collection and crushing it. So really strong starts for them. We all know how hard this is between the staff capacity, figuring out the right blend of people or persons. I think in these cases, there might be internships dedicated to data collection, which is a fantastic idea if you can make it work. But just, another idea. And I also see that there is Kate at Cincinnati Art Museum is mentioning the use of volunteers. So another strategy for re-engaging volunteers as data collectors. So lots of good ideas for in-person data collection and lots of successful stories there. And I love this. We're kind of wrapping a lot of the questions that we wanted to discuss all into the same conversation. So that's fantastic. So just, like, how is data collection going? What's changing in your community, or what's changing on site, and how is that impacting either, COVES data collection, visitor behaviors, operational procedures, anything like that?
This is Debbie with the Children's Discovery Museum of San Jose. We've maintained wearing masks on our museum floor inside the building throughout. We never took it away. We have relaxed it in Bill's backyard, and as of this morning, the whole county went back to masks inside. So that will solve any issues with people who didn't want to wear them. And we're still doing all of our surveys email. We email them the day after their visit.
Yeah, so that's great, Debbie. I'm curious about how this connects both across sites and from where we were even 6 months ago with the contact tracing efforts and how that has changed. So if you're not doing time tickets, Holly, you mentioned that about 50% are walk-ups, roughly. Yeah, I'm curious if that's true elsewhere, and if you've been implementing the email method, how you've accommodated perhaps not having an email address on file for some visitors.
Yeah, we're still, quote unquote, requiring reservations, though we are getting a number of walk-ups. A great deal of those people are the Museums for All, and they do have to fill out a contact tracing form at the desk. And then that information is entered into the database. The biggest problem is being able to read what they've written.
Sure.
There's some really bad
Exactly
handwriting.
why we don't do paper surveys. Well,
Yeah.
one of several reasons.
So.
But.
I'm not sure how useful this is beyond our example, but I'll share it. I'm Rachel. I work at the Minneapolis Institute of Art. So Holly was interested to hear what's happening over with you as well. We're in this very strange transition moment of we're a free museum. We did not have any kind of general admission ticketing system prior to the pandemic. We instituted one, which we then discontinued as of July 1, for lots of reasons. And then I was about to step into training with our staff around returning to in-person intercept surveying on our floor when we had a fairly tense conversation as a division about where we're at with mask policies, on-site return to work, all of those things. So held on that because it just didn't, coming out of that space, it just didn't feel right to then turn around and start to do that work sort of immediately after that conversation. But now we're in this very strange space where we're not collecting emails anymore. We are also unlikely, I think it will be our institution's recommendation that we do not do in-person intercepting anytime in the near future. So I'm sort of scrambling to figure out like iPad and QR options that are maybe not led by staff or as directly led by staff. I mean, I've been thinking about Crystal Bridges, your model a bit of having someone who flags people, but then you're not really having the interaction moment. So I think it's just feels like it changes so rapidly, and we were kind of all set on one path to go back to collecting data in a certain way, but we're now in this situation where we can't go back to what we were doing before. We have to come up with a third solution now. So it's just in that mix.
Is anyone else in that curious space between? I'd call it purgatory, but that's really negative. But just, like, you're in an interesting pickle, Rachel. Anyone else in that same situation? Not collecting email addresses, but not allowed or capable of doing in-person intercepts right now? Maybe you are in purgatory, Rachel. Have you, is just gonna own it, huh? Thanks, Holly. Have you, that third option you kind of mentioned, flagging people down, direct to QR, like could you just have the QR and then as we're seeing in the chat or as the questions have come up and then watch them do it, like treat it as an on-site random sample, but there's no equipment for you to clean and there's no necessarily interaction. I don't know.
No, and it's nice to read the chat because, we've been doing solely email collection without any QR up to this point. And I actually wasn't planning on any QR for reasons that we've talked about in this space in terms of needing to have a particular cell phone or type of cell phone, needing to be comfortable navigating that, being worried about finish rates and things like that. So it's nice to see how examples of how other people are using their QR codes and having them be effective, that's really helpful to see. Because yeah, I think that it will be some hybrid. It will be some hybrid, which, and I think putting out iPads and doing that piece is also not a problem, but we're just kind of, I'm trying to like just do some of those logistics. So yeah, I think we'll likely be in that model of flagging people and making the invitation, but then directing them somewhere not close to us.
I like this little side conversation about keyboards we're having in the chat. I don't know if St. Louis Science Center or if others actually have keyboards, want to come off and talk about, like, are people actually using them, or do they feel like a nice amenity, but people still just short answer, yes, no. Don't ask me open-ended questions on a tablet survey kind of thing. Do people use the keyboards?
Rebecca may have stepped away. I think from Elisa's previous comments, she seemed to imply that not everyone used the keyboards, took advantage of the keyboards, but they were there encouraging people to provide those qualitative responses.
Mm-hmm.
And of course, as Karen's pointing out and Beth's asking about, your setup is going to dictate how easy to implement the keyboard is. You do really need some kind of platform. So if you're not already using a stand, in fact, our stand wouldn't work because it's just for the iPad, but you need a little bit of space to be able to set up whether the keyboard's attached or if it's a Bluetooth or something. So for what it's worth, as I mentioned, we put one iPad in the stand and have one that we've been passing off. So you could consider just trying to have one space where the keyboard iPad is set up and then still implement like on a bench, or I guess the rest of the options are mostly bench users. Well, this is great. I'm eager to hear from more people. I don't want to start like calling on names, but there are a few sites on here who I've been curious about, and I see some faces and names, and I'm wondering like how things are going in Queens.
Hi, Ryan. I'm Kelsey. I'm from the New York Hall of Science. And we just reopened in July. And we've started doing COVES. I believe we started doing it 3 or 4 weeks ago. We have limited hours right now, so we're only open Thursday through Sunday. We're having interns and visitor experience staff give people iPads or ask them to use the QR code, so it is in person. I believe we've collected around 40 surveys so far, but our dashboard is not really working, so I'm not sure what that number is exactly. But we've had a mask mandate since we opened, and it hasn't been an issue so far, knock on wood. As far as I know, New York City hasn't implemented anything new yet, but that might be in the works. So I think we've been plugging along at a pretty good pace. My visitor experience administrator, Shamila, she's been excited about the pace we've been moving at and the amount of surveys we've been able to collect. I am new to the Hall of Science, so I can't speak for the past, but she does seem to be excited about that. So I think we're doing well so far, but we'll just have to see how things go, how our numbers increase and everything like that. So.
Thanks. And I'll do it one more time. Rachel, I know you already commented in the chat, but and in Sacramento, it feels like things have kind of been up and down. I know that the Bay Area in general has been heavily scrutinized, but between San Jose and San Francisco, so you're hoping to resume data collection in the fall?
Yeah, and we're not even in Sacramento County where the numbers are bad, but we're in Placer County where we're more militantly anti-mask. So we are reliant on government policy that's going to lag. So while all of our staff is masked while on the floor, I would say a good percentage of visitors coming in are not masked still, even though we're watching the news come up. So as a result of that, we're a small place. We haven't brought back volunteers. We're just starting to do that. And so our capacity is really limited before I feel like we can do that. We have implemented some programming where I'm watching the visitors and they would be great bait because they're sitting down. So I'm looking forward to being able to kind of begin to bring the iPads back out, but I just think capacity wise, we're not there yet. So hopefully by fall, and then actually I'll be reaching out to you, Ryan, as a small place. I'm actually interested in maybe bringing back something that wouldn't be a monthly process, but maybe a quarterly process and seeing how that would fit in. But I think we would be far better achieving our targets, and the data is so great, it would still be well worth it for us to participate if that's something we could do.
Absolutely. We're trying to be as flexible as possible. So
Yeah.
for those of you who have been continually collecting data, St. Louis Science Center is the easy example because you guys have been rock stars since July. It's kind of like business as usual, but for everyone else, it's worth noting that this is I hate to say it, but I'm going to do it, unprecedented times. And so because of that, like we've got no model to work off of, right? So we're just kind of saying like, we'll work with you. We want to make sure both that we're supporting you because we know how important understanding the experience is, not just for reopening, but just understanding what people are going through as they continue to recover with us. But also in terms of data collection methods and the questions and all kinds of stuff. So let me know how we can help. Most of us are on track for the people on this call, but I know it's a moving target as the agenda for today's call kind of highlights, right? You're in one spot and then things change and whoops, all my plans are out the window. So targets are the best example of that because the word target implies you're shooting for it. And as those of you who have received those target spreadsheets know, all we did was copy the ones from 2019 because I have no idea what your attendance is going to be and who's to say if those are realistic or not, but you do the best you can. So definitely email me if there are exceptions to the rule that you think we need to put into place. So I see some comments here in the chat about a rolling cart and hand sanitizer. We've also done that at the museum. I definitely think that if you are not kind of advertising the wipes for things, having hand sanitizer available has been really helpful. Another tactic, if you don't want to provide it with the iPad or as part of your equipment, I position myself and my iPad stand right next to the gallon jug of hand sanitizer that's in that little exit way that we use. So that could be implemented as well.
And your conversation about targets made me think back to a question that we haven't, I don't think we've really asked in a while in terms of what are your institutions seeing in terms of visitation patterns and sort of like what, you know, either compared to August 2019, July 2019, or even just thinking about, gosh, I don't remember when we were talking about this, but, you know, you have the ability to have 50% capacity and folks were hitting 15 to 20% or 8% or 25%. How, you know, how are people doing now? How are institutions feeling and visitor rates proceeding?
So the expo has been collecting, like we're creating weekly COVES report, and in our COVES report we sort of like compare some of the visitor experience data against the pre-COVID 2019 data. And what we have been noticing is that usually we see a greater like Net Promoter Score as compared to pre-COVID. And we also see a greater percentage of people saying their overall experience is either excellent or outstanding. So in terms of the overall experience rating, like ratings after reopened increased as compared to the pre-COVID era. However, like one area that we see a significant drop is the cafe restaurant experience. People are still complaining that having to like having limited space for dining and choices for dining is problematic. And we also noticed that in going through the open-ended responses, some people are like attributing like their better rating to the limited capacity. Like they are feeling like it's less crowded, which offer them more room and more enjoyable experience. So we do see some people like suggesting that limiting the crowd could be a highlight of our reopening strategy. Interested to see how this might shift if we are going to increase our capacity limit.
Thank you.
So this is Cheryl at Children's Discovery Museum, and I can speak to our attendance. We in July only saw about 44% of what we expected, and that is a reduced capacity. So our numbers are not going up. And that's unusual for us because we're a children's museum and it's summertime. So we expected a much greater increase.
Sarah, it's the case at MIA and probably in other places that we're at somewhat actually pretty spot on typical summer attendance, July and August attendance for the days that we are open. We're still on reduced hours. We're open 4 hours or 4 days a week rather than 6, and we're not doing any evening hours. So when you take those numbers out of it, we can make a pretty clean comparison. But I'm also anticipating that our attendance looks on track right now, but will look dramatically different in the fall when we don't have school tours return. So it's like, it's a question that our leadership team asks all the time too. And it's a complex one. And in terms of trying to set things like targets or that, it's like, for a typical Saturday in August, are we on track right now? Yes. Are we still about 5,000, 10,000 people down a week than we're used to? Yes. And will we be really down all of the fall? Yes. So it's like a very strange kind of calibration in this moment. And I imagine, especially with some school tour pieces, others might be in the same boat of, September looking more off than not.
Hi, this is Lauren from Seattle Art Museum. And Rachel, I think we're right in the same boat as you. Like for the days that we are open, we're seeing really good attendance. But we are working on reduced days and hours. So when we eventually sort of reopen to our full capacity, I'm wondering if we will see a drop, because now everybody's kind of crammed into this certain amount of days that we have open. And then, I think we're going to see, not good numbers when fall comes and we don't have school groups or things like that. So pretty similar.
We reopened our theater weekends only in May. And since then, compared to weekends in 2019, we're about 88% of where we were. So that's pretty good. General admissions are 77% of 2019, and our groups are almost the same. That said, as I mentioned earlier, we just had our largest school district say they're not going to be doing anything that is either in-person outreach or on site, and we're anticipating probably a lot more of that to come. So that's where we stand. And I guess the other thing I'd say is our store, for some reason, people are buying things like there's no tomorrow. There've been a couple weekends where it's above 2019 and we don't quite understand it. And of course, right now it's pretty hard to buy many things. And so our store person is having some difficulties keeping or getting things in stock. So, so it's been pretty good for the summer, but we see it with all the Delta variant that's not going to be the path forward probably for the time being.
Our attendance this summer has been pretty good. Not quite where we were the summer of 2019, but pretty close. to that. It's like June flipped a switch, and everyone just started coming back. We did reopen our all of our children's spaces. We have one, the under 5 space was still closed until early July, and we just opened that. You know, we have a hands-on grocery store, and so we had held off on opening that because of all of the manipulatives and how you keep that clean. And so our attendance has been great. And we are seeing some summer groups as well. The summer camps coming to visit, though maybe not quite as much in previous summers. And we already have some school tours booked for the fall, but are anticipating a smaller number.
Sort of there.
Yeah, we couldn't hear you at all before, but now we got a little bit.
Okay, you hear me?
There you go.
Okay. I just want to echo somebody said about the comments about crowds returning, because everybody loved it when there were no crowds. And then, I'm at the Natural History Museum of Los Angeles County. And then California opened up on June 16th. So I've been tracking our overall experience, our outstanding ratings. You know, they were here pre-COVID. And then when we first opened outdoors in the fall, it was like, you know, everyone was through the moon, best thing they've ever done ever. Same thing, we were outdoor in the spring, it went up. And then we started opening indoor and it went down. And then California reopened and capacity was lifted, and it's been dropping some more, still above where we were pre-COVID, but it's kind of, I'm on this swing of things returning and kind of to, you know, normal in some ways, but that people were really enjoying the reduced capacity, and now not so much. So.
Yeah, so definitely monitor those data, Xinyi, as you think about, you know, higher OER, higher NPS. We saw that when we first opened too, and it was something about a combination of capacity or just this desire to be back in that museum, and then a little bit of a tail off. But I'll be curious to see how that coincides with a lot of the discussion we're having. And I wanted to comment on a couple things. One, the weather, right? Same thing here, except it hasn't been heat. We had the second wettest weather in Boston in history. So rainy days, always good for attendance. Beth, I wanted to single you out because every time I see the commercial for La Brea on NBC, I'm like, oh man, their attendance is gonna go through the roof because they get all this free publicity sort of kind of, how's that gonna work? So have you guys talked about the tar pits at all? And
what commercial are you seeing?
I've been watching a lot of Olympics on NBC, and there's a new NBC show coming out this fall that's about La Brea. I actually don't know. It looks like you fall into a hole and you end up with dinosaurs. It's interesting, but
yeah, not dinosaurs, but Ice Age megafauna from asphalt pits. Yeah. Yeah, we'll see. I mean, it's really interesting. Our tar pits has been attracting. We have 2 sites, and we just started doing in COVID times the tar pits, and it attracts a really high percent of first time or like 10-year plus visitors compared to the Natural History Museum. So tar pits is doing a great job of just bringing in brand new people who are just hearing about it. It always has brought in more tourists than our other site, which is very local attendance, but yeah, tar pits is a pretty unique spot. You know, we'll see.
Yeah. And then the other thing that I found fascinating was Betsy's comment about the store, because when we first opened, and I think many of us had this conversation, we were really worried about supply chain issues. But, you know, if you remember March and April of last year, it was toilet paper. But then when the museum started reopening, it was hand sanitizer, and it was, you know, disposable masks, and it was one thing after another. I'm curious about this whole, you know, if your gift shop or museum store is doing really well, if there are supply chain issues elsewhere that we're noticing that are kind of reminiscent of last year. Has anyone had operational issues impacted by that?
Yeah, hi, and I apologize. I did not introduce myself before when I started talking. I am Karen Targer from the Great Lakes Science Center in Cleveland. So we have been running camps again this summer, and we definitely noticed supply chain issues with our camps. You know, we order a ton of supplies. It was more so that we had to be more creative on where to get things. You know, we typically order from Amazon because it's quick and cheap and easy. And even Walmart, we do a lot of in-person shopping at. And so we just learned very quickly that we needed more time to get things. You know, Amazon's Prime went from 2-day to like 5-day. Now they guarantee like 6-day for some things for Prime. So we just learned that we had to take more time out and be more creative with where we're getting stuff from.
All right, well, we get 10 minutes left. I've got one more obvious question. How are we using COVES data to support ourselves through this? There's been so many conversations, and I've emailed with so many people on this call about, you know, making small adjustments to the survey or making sure the link is right or getting the QR code or, you know, all those things. So I know it's happening, and you're all asking for the data. So I'm curious, you know, what are we hanging our hats on when it comes to the visitor experience that we're turning into either action or just, you know, it furthers an action that we've already taken, conversations we're having internally. Has anybody had some insight into that?
I can pipe up best I can. Hopefully I'm audible, but we were really focused on our wayfinding, because we've heard that through our surveys and our open-ended. So we did a deep dive, and we actually just added we added a map, we added floor maps. So we're kind of keeping an eye on that wayfinding rating that we added to our kind of general ratings. But I think that's going to play into how comfortable people are, because if you're lost and you're like feeling like there's a crowd and you're like worried about bumping into people, at least having some idea of where you're going and ability to kind of have, you know, a clear path back to where you were going should help a little smidgen. And we see that's kind of high on our correlation with NPS. So we're keeping an eye on that. It's not directly COVID related, but it's a big operational change for us. So we're definitely using it.
Besides the typical, you know, reporting to leadership about, you know, what's happening numbers wise, it's been really nice to have conversations with people on the floor to like let them know that like people do notice that they are having a great time, that they're really thankful to be here and like to be a part of what's happening at the Science Center. So it's been kind of, I like to use it in like conversational aspects with team members, especially now that we're going through, you know, the mask mandate again and all of the drama that comes with it, to remind people that like a majority of people are excited to be here. They're really happy about it and they notice. So like that's been a kind of positive, maybe a little bit different conversation than I've had before. So.
I think we're going to have to start shifting how we use this data. At the beginning, it was very granular, like Lauren said, the wayfinding, people were lost, and then our check-in process, complain, you know, this, that, and we've been responsive to that. I think now it's going to have to be more like longer term monitoring of trends, because I think there's concern that our visitors are less diverse than they were pre-COVID. So we've seen shifts in that. And I don't think we fully know yet kind of the shifts in age. We've seen, you know, more children groups. I'm not sure if it's seasonal, but so we're looking a little less like LA. Part of that was due to members were the overwhelming visitors when we first reopened. So we went from equal percents of Latino and white to like, woo, right? But now that it's back to normal, our kind of mix is not. And I think there's no easy fix to that. And so there's going to have to be, I don't know what the leadership want to do, but there's going to have to be some thought about that.
Yeah, I don't know about anybody else. I've personally shared more COVES data with new upper management than I have in years past. There have been more requests just for different data points coming from COVES. So either greater attention or just a greater awareness that we've got visitor experience data in a time when it is so important to be responsive to the visitor. So we had one sit down with I think our COO, and we just went through the open-ended comments from all of our high visitation weekends to see if we could see a trend in the open responses during periods where it was crowded, even though we were at like 40% capacity. And we definitely did. Can you guess what we saw? Visitors calling other visitors ask for their mask wearing or not, or whatever the case. And this was, you know, May and June. So, okay, well, just a couple minutes left. I'd open it up to final comments, but you've all shared a lot already. I want to thank you all for being here. I want to thank you all for being part of this community and supporting each other. I see that people have to run for their next call. That's why we're trying to end early. And I just want to say, as things come up, even if you don't get a response right away, because Alex and I are trying to do so many things, but we want to make sure we support you individually, you know, whether that means you as a person or you as an institution. So instrument changes, data needs, ideas about core questions, anything like that, please do reach out. We're trying to be as responsive as possible. And as we all shift, you know, be responsive to this time, slowly but surely, I do see us headed back towards normal, even if I just mean COVES operational. And what that means for all of us as a community is just the strength in the data, the reliance on each other, and you know, as Rachel was pointing out, just getting back to data collection and understanding our visitors. So thank you all for being here, and we will let you know when the next one's coming at you next month. Good seeing you. Take care.
Thanks, everyone. Happy August.